Today, vet schools market day one ready as a finished product. We tell this to vet students when they're applying, makes them excited for their entry into vet school. It also makes the veterinarians out in the veterinary community expect and be excited for their alma mater producing day one ready veterinarians. This can unfortunately lead to this idea that maybe more minimal mentorship is needed. But the truth is, it is not the expectation that you now can suddenly see 24 appointments on your very first day as a veterinarian. That is not the goal. Hello, and welcome to the Evolve Vets podcast. I'm your host, Dr. Bethany Weinheimer. Hello, and welcome to the Evolve Vets podcast. I'm your host, Dr. Bethany Weinheimer. Today's episode, we're talking about day one ready and the life of a new grad veterinarian. We know that this can commonly be faced with excitement, joy, and honestly, a little bit of imposter syndrome and challenge. So veterinary new grads, listen in. This is your final year of vet school. And if this is your final year of vet school or you're going into clinics, this is going to be a great listen too, because for you, this is the beginning of what clinical practice looks like. And we're excited to let you in on a few little secrets that we have here. Last week, my dear friend, Dr. Gary Marshall, I've known him for a while through TVMA and AVMA, and now he is the vice president of the AVMA. And he asked this question, is being day one ready? Is that entire concept coming out of vet school, being expected to be day one ready, is that the right language that we should be asking to our veterinary students? And I loved the question and thought it was so insightful because the truth is it might be adding a little bit of pressure to those that are graduating from vet school either this week or next week, or all across the summer, really. Now, what does day one ready really mean? And where did it come from? And I want to dive into the data around imposter syndrome, perfectionism, as we've talked about in previous episodes. So if you're interested in those, scroll back and listen in. But really, what does it take to survive in this first year out as a practicing veterinarian and eventually thrive? Those first few months in practice can feel intimidating, scary, and your nervous system can be stressed because you're experiencing something new. The life of these pets are in your hands, and you ultimately will be making recommendations and life in-depth decisions for each pet that walks through your door. The good news is, you've done a lot. You've finished vet school, and that's something less than 1% of the population can say that they've done. You've passed the NAVLE. You've walked across the stage. Someone hooded you during graduation ceremony, and somewhere between the graduation photos, the walk across the stage, you had that first thought creep in that said, oh my gosh, now these pets are in my hand, and I have no idea what I'm doing. They told me I'd be day one ready, but I don't feel like I am. Is something wrong with me? Do all my classmates feel like they're day one ready? Is it because I didn't make as good of grades on physiology first year? What is causing this feeling? So friend, listen here. You're not alone. Nothing is wrong with you. I've been out of school for about 8 years now. And the truth is we all have days where we feel like we're doing really well and days where we feel like we need a little bit of help. And that doesn't make you not prepared. It doesn't make you day one ready. So I'm going to give you a meditation practice so you can do in the bathroom between appointments and actually give you tips and tricks to better understand what day one ready means, as well as some new grad tips and tricks for all of you out there. And then I also would love for you all to listen to Dr. Molly Says podcast and my friend Dr. Garrett Marshall's podcast, because I know that they're going to be releasing episodes on a similar topic. And we all just really want to bond together and reach all of our audiences to really lean into this concept of making sure the new grads in our profession of veterinary medicine feel supported, loved, and cared for. Now, you guys know me. I'm a total nerd and love research-based medicine. So what does the research actually say? What does this day one ready narrative come from? Let's put some numbers behind what these new grads might be feeling, because if you feel like you're struggling, maybe there's a sense of anxiety that's brewing, you're not the outlier. You are part of an overlying concept of veterinary medicine. There is a Kogan study done back in 2020 that said 68% of practicing veterinarians meet or exceed the clinical cuff for imposter syndrome. And female veterinarians practicing less than 5 years out of school actually had the highest scores on this. Also, 68% of residents and interns also screened positive for the imposter syndrome during their studying period in their first few years out of school, compared to the academic facility where 38% of education healthcare professionals also had this feeling of imposter syndrome. And what this tells me is that it may not necessarily be bad that you feel like you have a lot to learn or that you have a lot to achieve, because even me, as someone who's been out for 8 years, sometimes there are still moments where I feel like I have more to learn and more to grow. And I just lean into the component of what can I learn today to make myself just a little bit better, 1% better today for the pets that are around me. And why does this come to life now? Well, one, we have graduating veterinary classes all across the nation and across the world, which we're really excited. But then I'm also seeing it all across social media. If you search vet med, new grad vet school on TikTok or Instagram right now, the class of 2026 and 2025 are openly posting about the panic attacks they might have before shifts, considering changing their career already only a short amount of time out of school. And it's not necessarily something that people aren't allowed to talk about or whisper about behind the scenes anymore. It's an open and public conversation that is really capturing the attention of people like me who really deeply care about this profession and want to make sure that you have a long, sustainable career in veterinary medicine. All right, so let's talk a little bit about what day one ready was supposed to mean. So the phrase day one ready was originally constructed by the AVMA Council on Education. And the thought was, could there be a baseline of clinical competencies that a graduate school should possess in the moment of a licensure? Right? So what are the base competencies that a school should provide to the veterinary students going through the skill itself? The concept was really engineered around this idea of, could it be a curriculum design tool? The goal was to make sure that training had more hands-on skills that were applied to veterinary schools. So that way, when you walked out, you were more day one ready. So for example, after my time in vet school, my alma mater went through a huge change in curriculum that they said would make students day one ready. After my time in vet school, there were more wet labs added, more hands-on teaching of ultrasound, and even more intensive communication around emotional intelligence and how to actually have difficult conversations with pet parents. And somewhere along the way, it got translated into a slogan. And now it's kind of turned into an emotional expectation that new grads carry into their first job. There's a massive difference between you hold a foundational set of competencies and skills to make you ready for day one, more so than previous classes with different curriculums. And you should be able to walk into a busy GP or maybe even an ER setting on day one and perform at all levels of your supervising DBM. That is not the case. The idea was that the first is more true than the second. The second maybe is more a fantasy, maybe a sense of perfectionism and imposter syndrome. And what I've seen from the comments and my new grad friends is that actually develops this intense anxiety and really doubt in themselves if they're ready to become a veterinarian on the other side. So the question becomes, are we setting poor expectations? Should we rebrand the concept of being day one ready? And let's think a little bit about how. So today, vet schools market day one ready as a finished product. We tell this to vet students when they're applying, makes them excited for their entry into vet school. It also makes the veterinarians out in the veterinary community expect and be excited for their alma mater producing day one ready veterinarians. This can unfortunately lead to this idea that maybe more minimal mentorship is needed. But the truth is, it is not the expectation that you now can suddenly see 24 appointments on your very first day as a veterinarian. That is not the goal. We conflate clinical knowledge with clinical competence. But unfortunately, they're very different. Our new grads are asking, am I really day one ready? And it's starting to foster this sense of anxiety and stress around starting the beginning of their careers, which shouldn't feel really exciting. Of course, a little bit nerve-wracking, but really we don't talk about how the nervous system comes online with this flight or fight and really this perfectionism and self-judgment instead of grace around this idea of being and practicing as a veterinarian. Competence isn't just a thought, it's a physiological state, and you can't just think your way into a regulated nervous system. That is absolutely not how it works. Imposter syndrome is when a competent person feels like a fraud despite evidence of their competence. And so maybe this idea of imposter syndrome showing up in a day one veterinarian is slightly off balance, because what's happening with most new grads is something different. It's slightly similar, but it's also a different type of layering, because you don't necessarily have the competence and proof that you've been a formal practicing veterinarian with all the success stories behind you, and you still feel the gap. The truth is, there probably is a fundamental gap between where you're starting on day one and where you're going to be, 5 years out of school, where you're going to be 8 years out of school, 10 years out of school. There is going to naturally be a developmental gap, and that's intentional. That's why we recommend finding places where you're going to find really good mentorship for you as a veterinarian. You want to make sure that you have the support from the people around you, and you have an environment where you can ask questions and really lean into your own development. Because the truth is, maybe it's not even imposter syndrome. Maybe it's just an anxiety that surrounds this idea of what should I be. And the truth is, if you find a great employer that really honors you in the place that you're at and provides you that mentorship, they're going to continue growing your skills over time. It's not going to be expected something that you have on day one of being a veterinarian. So the truth is, you are not an imposter, and it might not even be imposter syndrome. You're just doing beginner's work as a beginner. And the challenge is, no one told you, hey, you're still going to be a beginner the day that you start practicing as a veterinarian. Because we expect that after all the studying, all these challenges that we face, the ups and downs of veterinary school, passing all the tests, there's still going to be this moment where we feel ready. But maybe we don't actually feel ready when we start practicing as a veterinarian. Maybe that's where we start to rely on the mentorship, our peers, those group chats. I can remember when I graduated from vet school, the first time I saw a pig, I was probably a year out of vet school, and I had never seen a pig before. And I remember texting my little group of girlfriends from vet school. There was 10 of them, and just messaging and be like, what do I do? And luckily some of my friends had protocols for the different pigs that they've treated throughout their journey as a veterinarian. But it takes a village. And the fact that we expect ourselves to show up day one ready to practice without additional mentorship, without the partnership of our peers, without extra textbooks and resources, is just a completely misaligned expectation. So the next time you feel that thought of, I'm not really day one ready, and I feel nervous, I feel anxious, let yourself know it's okay to feel that way. That's a completely normal feeling, and that you're capable of learning. So my friend, Dr. Gary Marshall, vice president at the AVMA, actually said, what if we took this question of, am I day one ready? Am I ready to be a veterinarian? It doesn't feel like I'm ready to be a veterinarian, and changed it into this reframe that says, am I ready for day one? And am I ready for a new adventure, to start something new, to kick off my career as a veterinarian, and to make something great of each pet that walks through my door, and to help as many pets as I possibly can? And if you can say yes to that question and lean on the mentorship, then graduation isn't a finish line. It's just a step on your journey to becoming a new, excited veterinarian who is fulfilled by the clinical practice. And fun fact, that's why we call it practice. Veterinary medicine we call it the art of medicine. And the art of medicine is that it's going to constantly change, and we're going to constantly be learning and growing. And veterinary medicine is also a practice, because you're going to learn and grow as you get more and more tenure, more and more years under your belt as a veterinarian. You're going to continue to grow your knowledge base, your excitement, the skills that you see, and it's all going to be hands-on experience. So holding a practice is just baseline. It's just a starting point for where you can go next. But instead of putting the extra pressure on ourselves of saying, okay, am I day one ready? Am I ready today for all of the things that could possibly walk through the door? Maybe the answer is, I don't know. But I am ready to start day one, and I'm ready to do it with curiosity, with an open mind, and a depth to help people and pets when they really need it most. Because practicing medicine is developing skills throughout time that you get really good at, that you eventually perfect and become an expert in. It doesn't mean that the first day you walk out the door, you're expected to know every skill, every book, every procedure that might exist. But it's the confidence and practice to better understand how to find the answer. And the truth about medicine is we practice it. We rehearse, we refine, we get it wrong sometimes, but the more we get it right, the more we keep going, the more we learn, the better we get.
Let me speak directly to the woman who feels like she's barely holding it all together. You are still competent. You are still high functioning. Your team probably thinks you're fine. Your family probably just thinks you're a little disconnected. But inside, you're exhausted, irritable, disconnected, and wondering if you chose the wrong path. Code Blue Coaching is not about quitting veterinary medicine. You've already invested $250,000 or more in your education, and there's also been time, energy, love, and compassion given to vet med too. This is about reclaiming yourself inside of vet med instead of giving up on it. Over 6 months, I partner with you and hold your hand as we identify patterns keeping you in survival mode. We rewire the perfectionism loop that constantly happens, rebuild your self-trust and your self-worth, create boundaries you can actually hold, and you have your accountability from yours truly. Don't forget, we also get a one-on-one personalized recovery protocol just for you that will help you for years beyond our coaching time together. So what you get is accountability, nervous system tools, and a true hand-holding pattern that will help you through with a white glove experience. And if you've been waiting for permission to choose yourself, now is the time. Make that extra moment to prioritize you so that way you can sustain your career in vet med. Now, if this calls to you or you're curious, go to evolvevets.com where you can learn more and book an alignment call with me so that way we can better discuss if this is the right next step for you. I hope to see you in there and that we can stop this Code Blue moment.
When I was a new grad, I made plenty of mistakes. There were so many mistakes I made. The very first time, and I'll give you an embarrassing story just to highlight the fact that we all start from somewhere and we all grow and learn over time. I remember my very first pancreatitis diagnosis. I diagnosed it and felt really special, used the ultrasound, did all the tests, did all the blood work, and then I opened up the blood book bag, which was my go-to as a baby ER vet. And I remember reading it. I read the prognosis. I read the treatment. I knew exactly what to recommend, exactly what to do. And so I walked in that room, my little white coat on and my stethoscope around my neck. And I said, your dog's been diagnosed with pancreatitis. And I literally almost memorized the words. So I was reading out loud, what needed to happen for each phase of the dog. And they asked a few questions that I kind of stumbled over and tried to answer based on the textbook response. And unfortunately, this gentleman looked up at me and was like, are you even a real doctor? And I was like, okay. And I, panic, left the room. I remember looking down at my white coat and being like, am I a doctor? I think I'm a doctor, but I'm really not sure. And I read him everything that the book said. So where's the disconnect? But the truth is my clinical skill, my ability to diagnose the pancreatitis was there, but my confidence was not there. I couldn't relay treatment and the reason that someone should pursue hospitalization for pancreatitis in a confident way. So even though I was citing all the factual pieces, the confidence of why they needed to stay and what the best plan for the pet was didn't come across. It did not land. And that was a failure that I had as a young vet. And you're going to make many, many mistakes, just like that one. I had a guy ask if I was 12 at one point. And again, I was in my white coat giving a recommendation for a pet. And I just remember thinking no, I'm 25. I just went to, over a decade of school and I have all this extra professional training. And, here I am showing up my best for your pet. And then I get questions like that say you look young, you look 12. And there's so many hurdles that you have to learn to overcome as a new grad. and putting the extra pressure on yourself to have all the skills learned, all the confidence, all the spiels, memorized and factualized and down to a T, that's just unrealistic expectations. So I think give yourself a little bit of grace and say, how can I lower that bar just a tad to give me enough confidence and calm to give me the space to learn as I need to learn in the way that I need to learn from the mentors and the people around me, along with my resources. So now I want to send each of you who just graduated a huge welcome to the profession. I'm so excited that you're here. And I want to give you tips for the new grads out there. So if you just graduated from veterinary school or really any form of medical school, I'm sure all of these will apply. But I want to send you off with so much love and a few tips and tricks that hopefully will help build that confidence to change the question from, am I really day one ready, to am I ready for day one? So for me, a big part of this is taking this energy from force to flow. So if you're feeling like you're white knuckling it, your jaw is clenched, you're forcing yourself to do the procedure, even when you're not quite ready, it's okay to say like, I need a little bit of help, or I want someone to be next to me, or I want to learn before I practice something. And so here's a few items to go from that force energy of stress, anxiety, high pressure into a flow state where you're openly curious and you're learning and you're receiving from the people around you and you're prioritizing the pets and the customer experience when they walk through the door. So my first tip is lower the freaking bar. You're really going to hear someone say this in the veterinary profession, but give yourself some self-compassion, give yourself some grace. You've accomplished so much already and you deserve to be here. I can promise you that if you've graduated vet school, you deserve to be in this profession. And the truth is, comparison is the thief of joy. And your job, your first year out of school, isn't to become a brilliant veterinarian. It's to be safe, to be honest, and to be curious. You can't set the bar at, I want to be a senior clinician level your very first year out. You'll fail. You'll fail and you'll have so much pressure. That force energy, that anxiety will tighten around you and you won't have that open mind to stay curious and to learn, to give yourself the space to make mistakes. And the truth is, if you tell the truth about what you don't know and you ask your teammates for help, you will succeed every shift and you will become that senior clinician at the top of their game even faster because you're doing it from an emotional and an energetic place of excitement and love. Tip 2. Say, I don't know. It is a complete sentence. Practice it out loud in your car, maybe on your way to work, maybe in the mirror. Just say, I don't know. Let me check. I don't know. I'd like to consult with my colleague. Or just, I don't know. You can say things like, I'm going to look that up and come right back to you. The owners trust the veterinarian who says, I don't know, because it's better than being the person who fakes it. For example, me, like the example I just gave you guys, I was reciting a book, but the owner could tell that I was faking my answer. And then I probably just needed to go back and come back with a more clear answer after talking to a colleague. So ask your support staff. They're going to know so many things. Like, I would not be where I'm at today without my veterinary technicians, my veterinary nurses and assistants, CEC, helping guide me along my path. Ask your colleagues, your peers, your veterinarians. Ask your boss. Like, they hired you for a reason and they want you to be successful. And so the important thing to know, if you don't have the answer at the top of your head, that is okay. It is important. Even today, as a veterinarian, I don't know every answer, but I know where to find it and I know who to ask. And those are actually the better qualifiers than if you know every detail off the top of your head. This is not the same as in clinics or, when your resident is asking you an answer and you need to have it off the top of your head. Your client is going to be fine if you take the 5 minutes to look it up and come back with a clear answer and a plan for what they want to do next. Tip 3, find at least one other safe person. It doesn't necessarily have to be a mentor or your boss. It could be someone at another hospital. Like I said, my friends and I would put texts in a group chat that we still use today, 8 years out of school. You can have a therapist, have a coach, whoever it might be that's really going to help you. It's okay to say, hey, I just euthanized my 3rd pet today and I'm really struggling. I remember my first year out of school, I euthanized 14 patients on Christmas Eve, and it was one of the hardest days. And luckily, my friend group was so supportive and just like comforting me and giving me love and support. And the people on my shift gave me additional love and support, because the truth is, Isolation is an enemy in year one. It's not you have to prove yourself with that force energy. I need to prove, I need to be the best. It's going to create knowledge gaps if you don't learn to collaborate with the people around you. So find a mentor. All right, now tip number 4, track your wins, literally. Guess what? Your brain is going to remember the bad outcomes. It will happen. It's natural. It takes about 7 good comments for every 1 bad comment. So in order to keep yourself out of the spiral of the bad comments, keep a note in your phone. I used to save all my emails from employees and leaders that I led, as well as clients that really left a special mark in my heart, my inbox. When I was having a tough day, I would go reread those emails of why I'm here. What is my purpose? What's my calling? I've spoken several times about really tough surgery cases that happened younger in my journey as a veterinarian that really shape how I show up today and how they all were learning moments. And I would spiral on those. And so if you find yourself in a tough situation and you are spiraling, please, please, please reach out to me. Within our membership, we have a meditation that you can actually go back to and listen. And it actually teaches you how to break this idea of spiraling on a single thought and going down the drain. Because the truth is you can't show up for the pets you see the rest of the day if you're in the middle of a spiral based on a case that you saw that did not go the way that you hoped it would. So keep a notebook. Not only can you journal about the things that you learned, what tests to do for what, the different dosages that you can use for your patient, but you can write things like, I diagnosed an Addisonian today, and that got really cool. I caught the bladder stone. I did 3 spays in 1 day, or I did my first dental. Like, I made kids laugh while their cat got vaccines, or maybe it's I made a kid feel special by giving them a stuffed animal after performing a euthanasia. All right, tip 5, take care of yourself, please. It's so easy to want to hustle, to want to perform, to have these incredibly high standards for yourself. And then you teach yourself not to hear your body when it says, hey, I'm hungry and I need to eat. Hey, I really need to use the restroom. Or, hey, I really need to take a 5-minute break. That was really tough. So my recommendation is to do an inventory check just to see how your body's feeling throughout the shift. It's easy to let the adrenaline take over and push through. We're taught to push through, push, but that is the force energy that you want to stay away from. Really lean into your flow. Say, can I take 5 minutes today to eat and just sit in the silence? That's like my lifesaver in the middle of the 12-hour shift. Can I sit in silence and eat my warm meal with no distractions? That's the goal. And it's hard to show up your best self if you're dehydrated, you have low blood sugar, you're not going to focus as well, and your patience and your ability to retain the things that you learn will also decrease. I used to have a nurse that would come up to me and say, have you eaten today? If I started zoning out and not answering my questions as readily. And if I would looked at her too long, she'd be like, you haven't eaten today. And, it's 4 p.m. What are you doing? And she'll run and grab me a cheese stick and a soda or something to get my blood sugar up. But she's like, you have to eat. And that was one of the nurses that saved my career in veterinary medicine, because I would not have been able to keep showing up. And I was not aware enough of my body because I was so focused on pushing through and taking care of the pets in front of me that I didn't take time to say, Bethany, what do you need to show up best for the pets around you? Now, my best tip of all, which maybe this should have been tip number 1, but if you've made it this far, you get the good secrets. My true passion and the thing that I think is going to make you most successful at being a day 1 ready veterinarian is by leaning into the evolved method. Practice meditation, learn how to regulate your nervous system. It could be something small like listening to a meditation while you ride in your car. It could be, sure, laying on a couch or crossing your legs or listening to it while you're on a walk outside. But meditation isn't definite or defined by only doing it one way. It's finding a way to do it for you where your brain can relax, you can settle your nervous system, and really channel who you are, your purpose, and give your nervous system the rest that it deeply needs. This is called nervous system regulation. And by practicing meditation, we know that if you do meditation every single day for 8 weeks, it's proven to increase your decision-making, lower your emotional response, and really help you regulate your nervous system even better.
If you love this podcast, you find yourself nodding along, thinking, this is exactly how I feel at work, and sometimes even outside of work, then I want to invite you to something even bigger. Come with me to the Evolve Vets membership. It's my online home and community for women in veterinary medicine who are done surviving and ready to start evolving. Inside the membership, you're going to find race-approved masterclasses, vet reset meditations, live monthly coaching with yours truly, and a community of women who actually get it. It's not toxic positivity. It's not just another membership you sign up for. It's learning how to manage your energy, protect your boundaries, and build a sustainable career in veterinary medicine. It's your choice to move from self-abandonment to self-devotion. And the truth is, you don't have to do it alone, my friend. Come evolve with us.
So let's talk through the 3 phases that we do in the Evolve Vets method and how it can be helpful for you as a new grad. 1 is going to be meditation. So define a limiting belief. And if you're asking yourself the question, am I really day 1 ready? Then maybe the limiting belief is, am I not good enough? Am I not smart enough? Do I not deserve? Am I worthy of being here? All of those could possibly be limiting beliefs. Phase 2 of the Evolve Vets method is choosing a new belief. So what could be the new belief that's kind of the antidote to the one that we just discussed? I am worthy of being here. I worked really hard. I am allowed to make mistakes. I'm allowed to learn with curiosity and to grow from the times that I do something wrong. I am smart and I do deserve a place in this profession, right? So what's the antidote? And then the 3rd is going to be integration. Find a role model who really shows up in a way that they are worthy of being a veterinarian and they love their job. And can you actually take things from them and learn to apply those skills to your life? When you have a dysregulated nervous system, it's almost impossible to show up as your best self. Your prefrontal cortex is offline, your amygdala is flashing and responding, and you're reacting instead of choosing to respond. And when we're in a focused place where our nervous system can really rest, we have autonomy to say, this is the next best treatment, or hey, I know this client is really upset right now, but I want to handle this with a different perspective. So use the Evolve Vets method. Please join the membership if this sounds at all interesting to you. I want to do a deal. So if you're a new grad and you're open-minded enough to try this tip for your Evolve Vets method, I'm going to put a code in our challenge to give you a month of the Evolve Vets for free and where you can actually apply these tools. So new grads, use the code NEWGRAD2026. And I would love for you all to join the Evolve Vets method and try it out for yourself. My goal is that everyone stays in the profession as long as they possibly can and to find ways to regulate their nervous system and really just live a life that's more aligned instead of overwhelmed. And right now, if you're graduating from vet school and you're eager to start your first job as a veterinary professional, I'm so excited for you. Welcome to the profession. And also take the time to care about yourself. Your parasympathetic nervous system matters, and it's your job not only to treat the pets that you have, but to create an environment for yourself where you can show up to vet med day after day, excited, enthused, and really connected to the work that you do. So try it for a week. Tell me if your day doesn't feel different. It takes a while to get used to the meditations. Do it in a way that works for you. Go on that walk. Do it while you're cooking dinner. Put your headphones in when you're, brushing your teeth and putting your makeup on for the day. Whatever it might be, find that moment to reset for you because it matters. If you decide to join the Evolve Vets method, there's some really helpful tips. We have what's called a vet reset, which is anywhere from a 2 to 5 minute quick meditation that will give you access to how to better process a euthanasia, how to let go of a near miss, how to metabolize what happened and be able to process it, maybe cry it out. Maybe it's just acknowledging an emotion that you have, but taking those small pauses for yourself throughout the day by saying in the bathroom, hey, I'm going to listen to this 5-minute meditation, or I'm going to go into my lunch break and do a body check. I'm going to see how my body's feeling. And maybe you put one hand on your chest. Maybe you put one hand on your belly and you breathe slowly. Okay, I'm going to give you just a few mindfulness tips that really helped me when I was a practicing veterinarian. I would grab the handle and breathe in for 4. Exhale for 6. And then I would open the door. And the other thing that I would do, which is a huge tip, is I would actually tell myself, Bethany, this dog's name is Buddha and it's a boy. right? So tell yourself things like that so when you go in, you don't mess up. But it's just practicing awareness and giving yourself a mental break. Do during your lunch break, go out to the parking lot, go outside in the sun maybe, and listen to a body scan meditation. I have several within my membership specifically designed for veterinarians, but there's plenty of free apps like Headspace or Insight Timer that you can use as well. Better understand how your body is processing. Is there an area that's tight, intense, and anxious? Or maybe there's an area that's feeling really good and buzzing. And can you use the different parts of your body to really connect with yourself and get back to a place of stability so that one area isn't super tight and the others is super stressed? You can get to a place of like, okay, I'm equal, I'm centered, and I'm whole. Another good nervous system regulation tip is naming the sensation in a moment of overwhelm. So when you start to feel the panic rise, maybe it's the GDV that starts to crash and you get really nervous. Maybe there's an owner screaming at you. Maybe there's a customer telling you that you're only in it for the money and you really just don't know what to do next. Just silently tell yourself, okay, I'm feeling nervous. I'm feeling angry. I'm feeling a little bit mad and a little bit sad. There's a tightness in my chest and my shoulders are kind of pinching together and I can feel that there is a heat coming across my face. Okay, I'm going to choose to respond. My goal is to focus on Fluffy's care. And this was actually research done by Dan Siegel, and he calls it the name it to tame it. So when we name our sensations, our emotions, we actually can channel that prefrontal cortex and it dials down our amygdala. It literally helps you think more clearly. And within less than 10 seconds, you can reframe based on the outcome that you're looking for. There's a wonderful TED Talk video that I deeply love and I recommend to every new grad. So go and listen to it if you would like. It is called Making Stress Your Friend. And it teaches you all about the physiological changes that happen in your body. So think about it. When we get stressed, our adrenaline rises, cortisol rises, and our heart rate picks up a little bit more. Our breathing deepens. We're taking deeper breath. Our tidal volume increases. And in the moment, do we tell ourselves, oh my gosh, I'm stressed, I can't do this? Or do we tell ourselves, okay, this is good. The adrenaline circulating. This is my body preparing me for a challenge. And I'm smart and I'm capable and I'm ready for the challenge that's coming online. And so for me, this was a huge part of my journey through ER. I remember being 6 months out of school and starting to work overnights by myself. And there was these moments where these periods of stress or overwhelm would come on. And I would tell myself, okay, Bethany, I love this. I love being in the ER. This is just my body preparing me for the challenge. I'm smart. I'm capable. I know where to find the answers. And it is okay if I don't know them right away. And I swear that over time, my body now craves the adrenaline rush that I get from better juggling these patients and seeing multiple things at once or being in surgery. But I will say that was a skill I had to teach my brain throughout the years, teaching myself how to love the stress, how to teach myself that this is my body preparing myself for the challenge that I'm about to take on and that I'm ready and I'm confident and I can use myself, my resources, and the people around me to make sure this is a successful case. Another tip I recommend to new grads is doing a weekly reflection. So Sundays is usually when I do mine, because usually it's a little bit of a slower day. If I work on Sundays, then maybe I do it on Monday. But find a day of the week where you ask yourself, hey, where did I show up really well for myself this week? Where was I devoted to myself? And maybe where are the areas that I self-abandoned or I was a little bit too hard on myself this week? And I write it out. I journal about it. And it's the arc of bringing self-awareness and creating a transition from self-abandonment into self-devotion. Self-abandon might look like skipping lunch, holding out on the euthanasia to see the next drop off, saying yes to an overnight when your body was saying no, picking up an extra shift when your energy level was at 20%. Self-devotion looks like the opposite. Sometimes it's okay to say no to that extra shift. Make sure you take a break to walk outside, to listen to a podcast, whatever fills your soul during your break time. It doesn't have to be filled with questions. If you go to the bathroom, it's okay to not answer any questions about the pet through the other side of the door, which I've done many times. Just be aware and take note. So if you're going into clinics and you're learning and you're out in real life, starting to get your hands on your white coat, starting to get your hands on pets in a new and innovative way, please know that walking across the graduation day doesn't mean you're going to be day one ready, but it's a way to think about being ready for day one. So when you think about being day one ready, don't think about it the way your nervous system and flight or fight mode will think about it. You have to have everything ready. You have to be perfect starting day one of your veterinary career, because that's unrealistic expectations. What if instead we said, day one, I want to feel safe. I want to know when to ask for help. I want to know what resources I can use. I want to know when to call Pet Poison Helpline. Maybe I want day one to feel honest with myself, honest with my clients, honest with when I need a break. I want day one to feel curious. I want to be a learner and not a performer. I don't want to prioritize how other people see me. I always want to prioritize the pet's health. Maybe I want day one to feel regulated. Do I have at least one nervous system tool that I will commit to using in those moments that I feel overwhelmed? How will I see stress as preparing me for the challenge? Day one, focusing on regulating my nervous system. Starting practicing meditation now instead of waiting until I actually hit the job. So vet students and new grads, start this now. It's going to be one of the best decisions you can make for your career. And your future veterinary self will thank you, because you're going to have sustainability much, much longer than people who choose to walk away. So remember, you're not an imposter. You're not behind. You're not broken. You are qualified. You are meant to be here. You were told a story that you're going to be day one ready. And let the expectations settle to that just means you have a set of skills and you have a set of resources that you can lean on and work towards getting better every day. I'm 8 years out of school and I continue to get better at veterinary medicine every day. I continue to use my nursing team, my technician team, my veterinary team, my leaders alongside me to help make me great. Think about it. Surgeons do residencies. Lawyers have clerks. It's not just veterinary medicine that relies on others to make sure we're performing at our best. Also, think of the show The Pit. How often are all those doctors coming together and discussing a case as a team? All the time. And that's okay that you get to do that too. Readiness and confidence and day one ready doesn't actually start on day one. It starts with the mindset shift of saying, am I ready for day one? And can I take it case by case, breath by breath, and constantly being open to learning and growing. So again, if you're a new grad and you want to try the Evolve Vets meditations and our frameworks to help make you better prepared, please go to evolvedvets.com and type in new grad 2026. And I'll get to know you a little bit more from there. But I really want you to sign up, because nervous system regulation is going to be one of the key things for your longevity in veterinary medicine. I am so excited that you came and listened to our whole chat today. Please share this with other fellow classmates. Follow us along on Instagram and TikTok at Evolve Vets and at Dr. Beth the Vet. You are honestly so incredible to be here. You're less than 1% of the population. Your knowledge base is unique and special. Every single one of us deserve to have a seat in veterinary medicine. And thank you so much for being here today. It always lights my soul up, and new grads are so fun and so exciting. So remember, you're not behind. You're just on your journey and you're ready for day one. Good luck. Together, let's stop revolving and start evolving. Bye. Thank you so much for listening to the Evolve Vets podcast. It truly means the world to me. If this episode supported you or sparked something new in you, please go to evolvevets.com to become a member or join our coaching program and truly continue this work beyond the podcast. Let's evolve together.